Good evening, guys.
Hi, everybody. Welcome.
Welcome to Air Live.
Welcome to AI Live. Here we are again. This is our little give back to the community. It's something we like to do for free and get some education out there for you guys. So every month we like to do this for you. So thank you for joining us. We really, really appreciate it.
Yeah. We have a cool little topic today.
We do.
One of the newer toxins, not yet released in the US, but just got approved very recently in Canada. So we have something to look forward to. We're going to talk about it. And then we can talk about other little things, other toxins and stuff like that. If you guys have questions, let's make it interactive. The goal of this is to make it interactive. What do you guys want to hear about? Whether you guys want to talk about this topic more, or even talk about whatever is in the industry, whether Zerf is good, what you guys dictate it, right?
Yeah. We love to take questions. So you can always get onto the chat, and we have another TV over here that you can't see, and we can see the chat. So say hi to us, say hello, like your hair sucks, whatever you want to say, get in on the chat. Either one of us, I won't play favorites. Get in there on the chat and chat with us, and then give us some questions. And if we can't answer them, we'll look it up and get back to you. But if we can, we'll try. Yeah. But anyway, tonight we wanted to talk about Boey. Some people call it Boey. Boey, but it's Boey, so it's botulinum toxin type E. We are going to talk about that. We're going to talk about some of the research behind it, some of the information behind it, what's good, what's bad, what our opinion is on where this might go, where it might fit, where it might not fit. I think it's interesting, so we'll be talking about that.
Yeah, for sure. But before that, we have a couple of housekeeping
Wait,
things.
where have you been this last month?
Oh, where have I been last month? Oh, it was.
We have to recap our lives.
It was a busy month because I actually wasn't here.
No,
yeah,
I did it by my. Where were we? I did by myself last month.
Did you do it by yourself last month?
I was trying.
Are you sure?
I think.
No, you didn't.
What did I do?
No, you guys. We had Jared.
Oh, we did.
Jared was helping out.
That's right.
Yeah, both of us were busy.
know.
I was in Peru.
Well, we were in Korea first.
We were in Korea during Memorial. We were the 3-day stint.
Yeah.
3 days in Korea. So we learned all about smooth threads, which I think is really, really cool. I'm going to call it focused biostimulation now.
You know what? It really is focused. It's got
really
dermal
cool.
stimulation.
Right.
It's really
we learned a lot from
cool
it.
Thing.
It was really, really cool. Going back to the smooth threads and really rehashing that, I think is a very, very interesting talk, because PDO in Korea, they actually micronize it and they inject it like a Sculptra.
Yeah.
And so, if we can't inject it, at least we have the availability to use these smooth threads, place them in the dermis, and get this focused type of biostimulation. So I actually really I utilize it actually a lot underneath here. Not as much on the face as I probably should have. When I first got started with threads, the Korean ladies that I learned from did the big lifting threads, and then they actually placed a lot of the smooth threads on top. I just took it out of my combination practice because I didn't want the patients to bruise up.
Yes.
That was the biggest thing.
Exactly.
People didn't want to bruise. So I was like, okay, I do the lifting threads because I know I can do that without bruising them. But when it came to the smooth threads, I'm like, okay, well, we'll do it. And it was more just like, I don't want to bruise them, but knowing the science and understanding it, and we'll probably need to do a AI Live on smooth threads.
Yeah,
honestly.
we'll do that. Let's do that. We'll do that.
I think understanding the fibrous bridging, people don't understand the importance of it.
They kind of bridge together and connect.
And because that has to do with the retinacular cutis, which people don't talk about in our industry, and I think it's actually really, really important. With regards to that. So, I mean, I think that was
hopefully I got a fire under the butt of Galderma to do a study on that. I want to study on the retinacular cutis.
That would be an interesting one. Yeah.
So I'm hoping we can do a study on that.
I was in Peru training or doing talks on threads. So I was down there and I got a little bit of time. I missed Machu Picchu because I booked that late. So if you guys go to Machu Picchu, you have to book it way in advance because they only have a certain amount of tickets to go in there, because I think it's being trampled on too much. So they're limiting the amount of people that can go in there. But I had a great time. I ate a lot. If you watch my Instagram,
you always eat a lot. You eat everything everything raw.
So,
and the weekend after we were in Korea, was in Rome. So I was in Rome for Galderma. They picked 2 providers from the United States to be delegates to go to the global gain trainer event that was in Rome. So we went through a lot of new research, a lot of new toxins that are being used. The
Okay.
Rella is being used in Europe, not
We can
here
talk
yet.
about that a
We can
little
talk
bit.
about that, but really looked at sculptor body being done in the like amazing results of sculpture in the body that we're just going like, wow. So George Baxter Holder and I were the two that went for the United States, and I think we picked up more than anybody else because we really don't have this much FDA approved.
Yeah.
Super, super
And
interesting.
that's
That was
something for
super
you guys to
awesome.
realize. A lot of the things that are FDA approved in the US are very restrictive. When you guys get the free trainings from the companies, it's great because it's free, but it's a very big handcuff because a lot of us probably don't we utilize it in that way, but probably another 50, 60, 70% of what we use those products for, we use it in other ways, in other fashions,
Right.
and inject other areas. And so realize you guys need to expand your horizon. Going outside the country, I think, is important, or do private trainings for people who are doing outside the box things and not just sticking always with just, I got trained by Allergan, I got trained by Galderma, I got trained by MERS. When we train for them, it's a golden handcuffs. So
Mhm.
realize that, guys, as newer practitioners, don't just rely on the companies to give you the training. That's like going in the real medical world. It's like, I'm only going to use the drugs that the drug reps come around and give us.
Mhm.
That's kind of what you're doing in the industry of aesthetic medicine because it's not as regulated. But when we train, we only train on label of what was FDA approved, and we can't talk when we're training for the companies off label.
Right. And think about why we are there when we do train for the companies. We are there to help the providers understand the product. What is it? How does it work? Where do you inject it? We're not there to teach you how to hold a syringe. So, it's one of those things that
Yes.
it is limited, and the focus is not helping you become a better injector, which we end up teaching them and they do anyway, but it's really helping them understand whatever product we are there to tell them about that we really
Mhm.
like and believe in. So,
So, realization for you guys
yeah,
out there, take your education into your own hands. So, thank you for spending time with us tonight,
yes.
getting educated as well.
Thank you.
We have all of our stuff,
We
but
digress.
we we actually have a lot to talk. We have housekeeping things, so
Okay.
a lot of education. So, what do we have? We have our ultrasound course here for those of you guys that are jumping into ultrasound and
That's this
aesthetics.
weekend. I don't even know if we have any.
Oh, that's this
That's the
weekend, July
11th. I don't
11th.
know if we might
Oh.
have a spot left. I don't know. Yeah, if
If
you're
you
here
are,
in Southern
reach out
California,
July
Saturday,
11th, Saturday.
you can see if there's a spot. It's going to be awesome. The ultrasound course is so, so, so important in your aesthetic specialty. I can't tell you how much it's helped me and how much I love ultrasound. So if you can't jump in on this Saturday, if you haven't already signed up, please, please, please sign up for a good ultrasound course. It's
Yep.
huge.
There is a AI webinar on Agnes. So this is a microneedling radio frequency in a single form to actually work on fat destruction, a little bit of skin tightening. It's a great modality. It's very interesting what this little device can actually do. So our partner Aaron Barini is going to be doing that webinar. It's going to be July 14th, and it's going to be at 5:30. It is a really, really cool device, guys. It's not like your typical microneedling RF where there's like 16 pins, 25 pins. This is 1 pin, 3 pins, where you can really go in and focus, killing off fat pads underneath the eyes, a little in the jowls, a little bit in here, a little fat bra area. So this is really about focusing on fat, though you can do a lot of little skin tightening things if you want, but I really do love it for the fat component of it. So that's microneedling RF. July 14th.
And then we have our Foundations for Advanced Aesthetics. This is July 18th. This is full, but September 26th, I think that we have some spots still open. So if you want to come in for that, that is the hands-on. You do the soft tissue fillers. You can do some toxins. You bring your own model, and it's all day long. There's about a good 12 to 14 hours of didactic you have to do
Mhm.
before you come to the course. So you have to prep for this course. It's something where you get so much comprehensive foundational information. I will guarantee you that if you've never been through a very comprehensive aesthetic course, you will know more than the 5 to 10 to 15-year veteran injectors that you work with in your clinic. Unless they are a leader in the industry, you will know more than they do because most people have never taken a course like this. So this is really, really good. And we give you a year to rewatch the didactic. Then one day you come here on those days and you have your model and inject your model. We're here holding your hand. We're here with you. So it's a great day of learning.
Yep. So July 18th, unfortunately, that
That's
date
full.
is already full. So the next one will be September 26th. So if you're interested in joining us for that,
Yeah.
reach out to the team at the Aesthetic Immersion. Next, we have dissecting aesthetics. This is our anatomy experience with Dr. and Professor Sebastian Codafana. He's going to be here live in person at Brea. There are only 2 more spots, unfortunately, left for this course. It's the 2-day course, August the 15th, which is lecture and live demos, and then August 16th, which is the hands-on dissection lab. So the 2-day course, there's only 2 more spots left. If you can do a 1-day course, there is the 1-day observational course that is still available. But if you're really wanting to do something with anatomy, this is amazing. You guys know Codafana produces crap loads of anatomy papers out there that have really made a big difference in our industry. So he's a wealth of knowledge, and we're going to work with him and pair it up with how it aligns with injecting and do live demos and stuff like that.
And like one thing about Professor is he is the only true anatomist we have in the United States. And a lot of people don't know that.
Yeah.
Most of the people who do dissection courses are usually plastic surgeons who like anatomy. They just love anatomy. And we know all of them. They're super sweet. They're great and they're smart. But Sebastian Codafana is the only PhD in anatomy. He's the only one who is a true anatomist that we have in our country. And we're really, really fortunate to have somebody like that that is so knowledgeable about it and does so much research on it. So this is really, truly something special. Yep. So if you can come in August, you won't be disappointed.
Yeah, August 15th and 16th. There's only 2 more seats available for the 2 days to be able to attend 2 days. Otherwise, there are some for the 1-day observations. Okay. And then let's see, our AI webinar we have on Agnes Ultra, which is the newer version of the Agnes, which actually has these little cannulas that actually can do more fat dissolving and are a little bit bigger, so you can do body parts and stuff like that. So it's a lot more of a bigger machine in a sense and can do a lot more with regards to what it can do. So August 25th, if you guys want to join that AI webinar, it is August 25th on Agnes Ultra.
And then on August 29th, we have so many things going on. August 29th, we have our Fundamentals of Neurotoxin Injections course. This course, if you know of anybody or even you yourself that are like, I don't know if I should get into aesthetics or not. I'm currently an OB or I'm an internist or I'm in oncology and I want to do something different, but I don't know if I want to do aesthetics. This is the course for you. It's not expensive. You get a 4-hour didactic before you even come. So you get a good basic knowledge of what's going on. Then you come here to Southern California in Brea, the clinic, for a full day. And you get to play with injecting toxins into a silicone head, like it's water, and then you get to feel what it feels like to push jelly through a syringe and what it feels like on paper. So you're not injecting people, but it's a really good feel to what it is. And then you get to watch us inject patients, real patients. So it's a really, really good day to help you go, yeah, I want to go into aesthetics, or heck no, there's way more to this than I ever expected. And I will stay in brain surgery. I'm okay. So it really gives you a good idea of if you want to dive into this.
So if you want to come and learn, that's great. But if you have friends that I kind of want to get interested, is it for me? This is the great course for those that are just peering over the fence and seeing, is that grass greener on the other side? And it's to really, really welcome them in and to really give them a really in-depth viewpoint of what aesthetics is all about in our specialty.
Yeah, we've had a couple people go, oh my God, no, I'm going to stay in oncology because there is way more to aesthetics than I ever dreamed. I mean, if you're working in it, you guys know anatomy, vascular occlusions, infections, there's a lot of adverse events that can happen if you don't. It can happen to anybody, but people just think it's Botox. It kind of cracks me up. So there's a lot more to it. And I think people start to respect our subspecialty in medicine much more when they understand what we actually do. Yeah.
And last real big one is our AI Founders Summit.
Yeah.
This is going to be October kind of 16th in
16th,
the evening,
17th, yeah.
but it's really the 17th.
Mhm.
This is our summit for our own members, but it's open to everybody. If you are a Founders member and you're listening, you guys can actually register for free. So this is our way of giving back to those that have been supporting us over the years and our Founders members. If you join our Founders members, you probably can join us for
Yay.
free for this. So
Yeah.
look into our membership levels. But this is going to be a networking event. We're going to have live dissections. We're going to be talking about advanced
Ultrasound.
we're doing
We're doing
ultrasound. We're doing like advanced aesthetic injection techniques,
Mhm.
stacking techniques, and things like that. So it's gonna be all day the 17th, but the 16th think is like an evening dinner
Yeah.
to just network and get to know each other. It's gonna be here at the Aesthetic Immersion and partly in Lori's clinic here at Skin Perfect in Brea.
Yeah.
So if you're interested, reach out to us. It is the AI Founders Summit, and it's going to be October 16th and 17th.
So book your plane flights
So,
now, you
yes.
guys. Come out and hang out with us.
And
It'll be a
don't-
great
And
time.
don't forget, we have our mentorship levels. This is all hands virtual videos. We have 3 different levels. We have the starter level, the insider level, and then the founders level. If you do join the founders level, you'll probably get an invite. It's for free for all of our founders. This our summit in October. So if you are interested, join up so that we can network and get to know each other and really grow this industry properly.
And it's funny because every time we go to conferences, we meet people who are, and you might be out there that are in our mentorship program. And thank you so much if you are. And if you're one of those who come up to us and let us know how much you love the mentorship program and how much you love watching the videos and how much they mean to you and help you in your practice, that makes us happy. That's why we're doing this. If you don't have somebody with you to support you and back you up and to ask questions of, that's why we put this mentorship program together. So thank you so much for coming up and letting us know how much you enjoy it and love it. We really enjoy making a lot of the didactics and the modules to help. We constantly do new ones. Constantly, when new research comes out, we'll do modules for you. So there's 450 modules or something. So I don't think anybody's ever gotten through it all. But we know you appreciate it and we're happy, and that makes us want to do more.
Yeah. All right, so we're done with housekeeping.
All right.
Now we can get to today's topic.
Boey.
How do you say it? Is it Boey?
It's Boey.
Boey.
I
It's
think
like
of-
Joey, right?
It's not,
Joey,
It's
Boey.
not Boey Gooey. It's Noe Boey. It's
Noe Boey.
Boey.
All right. So really, let's talk about Boey. This is the new one that will be coming out from Allergan. It is recently approved in Canada.
Mhm.
Unfortunately, it got held up a little bit in FDA. Bull crap.
Mm.
That's what I call it.
It's something like it got held up. We tried to get FDA approved in April
Mm-hmm.
here in the United States, and it's called like CRL. It got held up in the processes. It's the assays. So it's not that it's not a safe product. It has to do with the way in which they're making it, and it's laboratory stuff. So it's usually little something.
You guys don't realize when these medications go through all of these processes, it's not just making sure it's safe. They actually go into the actual manufacturing side of it.
Mhm.
What kind of facility it's made, how the distribution is, how is it stored. They have to go through the whole cycle of it to make sure that from start to finish, it is a safe product. And this is the reason why, you guys think, oh, some of these products are more expensive and blah, blah, blah. Well, there's research that goes behind it. And then you have to go through FDA on all the aspect of it. And then there's a whole process to make sure that from the time it's made to the time it's shipped to you and the way it's stored and the way it's shipped to you, there's a whole process.
Yeah.
And you guys don't even think about it. But that costs money, unfortunately. And that's the reason why neurotoxins are not super cheap here in the US. And you can get them cheaper elsewhere. Just make sure you realize if you are buying it from a secondary person or you're buying from outside the country, it's actually not very legal to do that.
Yeah, I just found out how
So-
much like Dysport and Latibo are in London.
Oh, you didn't realize how much they are? They're very cheap. I mean, Allergan in other countries is probably a third of the price of it is here
How
in
about
the
like
US.
less?
Yeah. Oh, I know.
How
Yeah.
about like less?
It's very, very
Yeah.
mind-boggling how these products in other countries are a lot cheaper. Welcome to the world of lawsuits and welcome to the world of the USA.
Yeah. Yeah.
But we digress, and we're gonna jump into Boey rapid onset, short duration neurotoxin. So let's jump into this PowerPoint that we created.
And guys, we just want to see the chat if we can, please. That'd be awesome. All
Um,
right. So Allergan Aesthetics is getting this FDA approved. It will be, since it got delayed a little bit, usually when it's delayed because of the processes issue, it's going to be usually 6 to 12 months, usually 9 to 12, before it really comes back around to be FDA approved again. So we're looking at least 6 to 12 months before this comes back around. And it's known as BoNT, so it's botulinum toxin type E.
mhm.
It's trenibotulinum toxin type E, which it's treni.
Treni. How'd
Yeah.
they get Boey? Probably 'cause
Bonti,
this
maybe
is
Bonti,
E.
Boey. I don't know.
Bot-E.
Bot E.
Something.
I don't know. There's probably
Anyway,
somebody smart that thought of that.
neurotoxin serotype E.
Mhm.
And remember, if you guys go back to even the science behind it, they have botulinum toxin type A through G.
Mhm.
So they're actually, I think, maybe even H, I think. So there's type A through type H. So there's actually a lot of different types, serotypes of botulinum toxin. Currently, we just use A, and we do use B. That's myoblock. And then there's now going to be E that
Mhm.
will be hopefully released sometime this year, maybe, or early next year.
6 to 12 months.
Yeah.
Yeah.
So it's for temporary improvement of moderate to severe lines in the glabella area, as all neurotoxins are getting approved, is typical area. The cool part about it is it's rapid onset and it's very short duration. So we'll go into that a little bit more in the next or in the later slides. Um, I think this is going to be used by providers or by patients as a trial run.
Maybe.
Patients who don't actually like. You get patients who are like, "Oh, I'm never going to do neurotoxin. Oh, no, 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 no." Now it's a kind of a little bit like, "Hey, you want to try it out?" It's kind of like, here's a little dangle, here's a little
Right.
taste of it.
Here's a little taste. See if you
It'll
like
kick
it.
in a little fast. It'll last probably 2 to 3 weeks, maybe up to 4 weeks. But it's a one that's like quick in, quick out, and it's for those that just don't want long-term commitments. Really, just not
Yeah.
long-term commitment. Let's see how it is. That you're probably going to pay the price for this shorter duration type of thing. But I think people will pay that just to see, okay, I'm kind of liking what this could potentially do, and then they can end up doing the neurotoxins that actually last longer.
Yeah. Yeah. It's interesting. It's just another little tool in our toolbox. And it's something that patients are going to hear about. So that's why we wanted to bring this to you now and kind of let you know everything that we have heard and what we know about it. We haven't used it yet,
Yep.
but everything
not
that we
used
know and we've used about it. So I think that BoNT-E is something I heard about this a few years ago, probably at least 3 years ago, that John Joseph, who's done a ton of studies with botulinum toxin type A's and now and E's back then, he was telling me about this, and he also thinks that this might reverse A because it cleaves the SNAP-25 at a different level.
Yes.
So this is all very interesting.
Yes.
As far as now we're looking at different places the SNAP-25 is cleaved, and
Yep.
if it cleaves at a different level, then why does it work so quick and why does it wear off so fast? So, it's interesting.
Still understanding.
Yeah.
So, let's see. Approval status in Health Canada, June 23rd.
Mhm.
Still not here in the US. So as Lori explained, 2026, there was a complete response letter, CRL, relating to the manufacturing process. And that is what is being resubmitted and all of that through with AbbVie to the FDA. And so I think this is happening
Mhm.
to
It's happened to
the
QM. Relfydess.
the Relfydess that you guys were asking about.
Yeah.
That is essentially the same thing. They just, unfortunately, got this same kind of response that now they
Mhm.
have to go and respond and really figure out the laboratory processing and manufacturing process. So it doesn't have to do with the safety of the product or anything with the clinical trials. They don't have to redo clinical trials or anything like that. It just now goes back into the actual manufacturing process of these neurotoxins. So
We have a question. Gloria is asking, will these work on the patient that's resistant to botulinum toxin type A? Theoretically, yes.
Theoretically, yes.
Because it's not the same exact molecule. So
Mhm.
if somebody's resistant to A, this probably would work. You just have to give it to them every 2 weeks.
Every 3 to 4.
Like, right? It wears off
Maybe
pretty
they're
quick.
well, we'll have to figure out, is the dosage equals duration too?
Yeah,
I mean,
we'll
you could put
see,
a bigger
right?
duration. I mean, put bigger dosage. Maybe you can last a little duration, and maybe they're not doing it every month. Maybe they're waiting every 3 or 4 months to do it, and so they'll
Mhm.
go in and out, and then they have a little time for it to kind
The
of
wrinkles to come
the
back.
wrinkles to come
And
back, the
then,
muscles to strengthen up, and then wrinkle. We'll have to play with it.
yeah.
I think it'll be a very interesting thing. We don't know what the pricing is. I mean, I don't even know what it is in Canada at
You know,
this point in
that's
time.
that's interesting because somebody was asking about how would we price this service. Paola, thank you. Good question. I don't know, because it depends on how much Allergan prices this product.
Right?
So toxins are becoming a commodity now, you guys. Toxins are not something we make our bread and butter off of. You don't make that much money on neuromodulators.
Well, you can, depending on which neuromodulator you're starting to use now.
Well, until Latibo came on the market
Mhm.
and totally discombobulated this market because they came on, they're like, we're not going to play games. It's one fee. That's what you pay.
I love it.
It's not quantity. It's not how often you order and how much you order. Here's the
This
price.
price. You
And-
order this amount,
and-
you get this price. You order
and
this
it's-
amount, you get this price.
It's like half almost of what some of the toxins are.
Oh,
So,
no.
and when you think about neuromodulators, botulinum toxin type A, they are all the exact same molecule.
Mhm.
So I love Dysport. I'm a Dysport freak. Why? Because it lasts so long. It works so well and lasts so long.
Right.
But what you're getting in essence is you're getting a stronger dose. You're getting a higher dose of Dysport because it's the way it's calculated out in the nanograms. You're just getting more of it. So more of it means it lasts longer. It's simple. It's very simple.
Yeah.
So it's not that, like, when people get something new, or if you get something for a lower price, be it a filler or a toxin, it doesn't mean that you have to price it lower in your clinics,
Right.
because it is not less than.
No.
You might be getting it for less money, but that's where you can at least get a little bit of profit in
Yeah,
your
for sure. Don't
because your
lower the
consumables.
price. Just because you get it
Price
cheaper,
is the same.
that doesn't mean it is less of a toxin. It works just effective. In
Yeah.
fact, it's the number one used in Korea.
Yeah,
And
it
with,
is.
with
Latibo
20
is.
plus neurotoxins in Korea to come out
Mhm.
on the number one used in South Korea, and they're in 65 different countries, it tells you that there's something to it. There's more to it. I think that there has to do with the different strain. It's not the Hall strain.
Right.
So realize Latibo is one of the first ones that on the U.S. marketplace is not from the Hall strain. All the other ones, the Juvos, the Xeomins, the Dysports, the Botoxes, all of those are actually from the Hall strain of the Clostridium botulinum
Yeah.
bacteria, versus the one from Latibo is a different one. Galderma's is
Yeah.
also from a different strain as well. And so that goes into possibly, and I have seen this where people are starting to get a little bit resistance to the Hall strain versions of it. And then I use Latibo and it seems to kick in
Oh,
stronger. I've actually seen that on my patients. So, there may be something to that aspect of it. Is there something maybe slightly different about the botulinum toxin type A from the core toxin of a different strain? Could be. I don't know. We'll have to go into the biology of that. I don't know if
Yeah.
anybody actually has looked into that as much on the aspect of it, but it's something to think about, because I have seen it on my patients where I'm like, ooh, that one doesn't, the Dysports, we used a lot of Dysport, doesn't seem to be as strong or lasting them as long. And I flipped them to Latibo and they actually did a pretty decent.
See, I haven't
Yeah.
had that happen, but my whole theory of mixing toxins, don't mix your toxins with bacteriostatic saline. Just don't. You
Yeah.
mix it with straight saline, not bacteriostatic. Because in your normal saline, in your bacteriostatic saline, you've got benzyl alcohol. The benzyl alcohol, when mixed with your botulinum toxin type A, will degrade 20 to 40% of that core molecule immediately, which means you're killing off 20% of your botulinum
Effectiveness.
toxin molecules before you even inject them in somebody immediately.
Yeah.
So if you mix just normal saline with it and not benzyl alcohol, just straight normal saline, which burns like heck?
She
Because
realized that.
normal saline has a pH of in the
5.
bottle, it's a pH between 5 and 6. Wh- What part of normal is that? What part of what's our pH of our body? 735 to 745. So that isn't normal. So what I do is I alkalinize it. I'll add a tiny bit of bicarb to bring the pH up to 7.3-ish. And then that's my diluent, and I put that into my toxin bottles and
Mhm.
reconstitute with that. That's already I brought the pH up a little bit,
Yeah.
and it doesn't sting at all.
Yeah.
And the core molecule of botulinum toxin type A is not sensitive to pH. It's sensitive to benzyl alcohol, but
Mhm.
it's not sensitive to pH.
Yep.
So when you make it more alkaline or more of a neutral body pH, then it is perfectly fine and it works beautifully. And I see it kick in faster and wear off a little bit longer, and that's because we're giving them the dose that we thought we were giving them in the first place. So
And this came out
there's
of
my digression.
and this came out of research a couple years
Yeah.
ago when I was talking with was it one of the medical director? Oh, he's one of the
Rui.
the scientific people. I mean, he was on the scientific team, the MSL, medical science liaisons for MERS. He was on there,
Ah,
Juan.
okay.
So he's now with Latibo. And when I was talking to him, he actually mentioned the thing with the benzyl alcohol
Mhm.
in the bacteriostatic salines. And he sent me a paper that they observed that they were able to reverse out some of the neurotoxin results. So they had, out of 22 patients who had brow ptosis, where they dropped the brow, they injected bacteriostatic saline in here and
One side. Mhm.
and out of that, 21 of them resolved. And I actually have a case where we actually totally drooped an eye and we used bacteriostatic saline injected into the muscles. And within 3 injections, so within 2 weeks, 3 weeks, patient actually had complete resolution of her droopy eye.
Yeah.
Now, it doesn't happen with every single buddy, but I have found probably in 70-80% of the patients that we do, if they drop the brow a little bit, they feel a little heavier, you drop the DAO and you wanted to, you can inject a little bacteriostatic saline. So you can look out for that, research looking for it if you want to read up about it.
I've tried
and
it. I
stuff like
haven't
that.
had a great result with it, but
Mm.
you know what? If that works, if the benzyl alcohol reverses it, guys, if you know how botulinum toxin type A is supposed to work in the cell, cleaving SNAP25,
Mhm.
if we can reverse it with benzyl alcohol, are we really cleaving SNAP25? So do we really know exactly how toxins work in the motor end plate? So
I mean, this is for
yeah,
us to.
I told you we
This
digress,
is
but
for
this
us
is
to
so
really.
interesting.
It is very interesting.
I would say be curiously critical, like be curiously critical. Just like always have your curiosity with your critical thinking going so you can kind of go, why, what? And
Yeah.
don't just take everything for granted of what people say. Melissa said something earlier. I know Melissa asked, how much bicarb do I add to 30 cc's? I actually get about a 10 cc vial of the normal saline because I don't want to sit around for very long. And I do put it in the fridge, but I add usually about 0.1, 0.1 or 0.11
Like a
of
1%.
bicarb. So get some pH test strips off Amazon. Okay. Test your normal saline first, see what the pH is, and then just take 0.01, like a tenth, and put that in your 10 cc vial of saline, shake it up, take a different syringe, not the bicarb one, different syringe, test that, put on your test strip, make sure you're around 7.3 or so, maybe 7.3, 7.4, and that should be fine. And then just know what you're adding. I tested each time because the normal saline pH can be different with each vial. It can go from 5 to 6. So
Typically, you're going to add about 1% in there.
Roughly, like
roughly
a
about 1%.
0.3 to a 30 ml,
Yeah.
roughly. But you don't want to add too much because you can't take it back out.
All right. So global rollout, Europe is close. China is probably this next year, kind of like the US. So everybody's on hold. The first one that got approved is Canada, I guess.
Yeah.
So this is the global rollout. So the science of it. So traditional, neurotoxins are serotype A. Boey's going to be serotype E. And so both serotypes block the signals at the neuromuscular junction, which they both actually affect on the SNAP25. So it is still the SNAP25 receptors. It's just, from what I read, is that I think E cleaves up a little bit higher up in a lower up.
Lower.
So lower. So it actually splits it into a more even. Was it even? C terminus. It's more closer to the C terminus, right? Is that, or
I
was that, I confused them because I just started reading about it.
I just know it cleaves low. The thought
I
is that it
remember.
cleaves lower when I talked to Dr. Joseph.
I remember. I pulled it up.
Oh, good.
Let me
Perfect.
pull that
We learn something every time.
up.
But it's very interesting because and when you think about it, dose equals duration. So the
Mhm.
more we think about this, the more we think, okay, why does it kick in very quickly? That tells me it gets into the motor end plate very easy. So given the structure of this molecule, somehow it gets into the cell very easily. It cleaves, but it doesn't cleave a lot because it only takes the cleaving of 10% of the SNAP25 to render paralysis. So say that Bonti goes in there, or Boey goes in there and cleaves 11% or 12%, right? It doesn't take long to grow it back to where you're 10 or 11% or like 9% cleaved. That's less than 10%. So you can get that movement back. So it might be that I don't know, but it might cleave less. It cleaves at a different spot, but cleaves less, and then you're going to get that movement back because you'll get more SNAP25
So
back.
type A cleaves near the C terminus. Type E is much closer to the middle of the protein, removing a larger portion of the fragment.
So it cleaves down lower on the
Yes,
protein.
exactly.
Which, if it does cleave, which means cut, how do you reverse it? Right? And then the thought is, like Dr. Joseph was saying, he thinks the E reverses A.
There's a potential. I mean, if you're blocking at the C terminus, which is a little closer up, and now you cut it down here, you break off A, you still have that remnant that's going to maybe the E that's going to last for a couple of weeks, but then in like 2-3 weeks it disappears. So
Right?
it
Interesting.
does, but you still have that length that the E has to play its part before it works out.
Interesting.
So it's very, very interesting. What else? The injections are made into the same area. It will be a different unit system. So it's going to be 1,400 units of powder for the solution. So remember, this is going to be completely different than type A. So you cannot compare
No.
this apples to oranges like MyoBlock and
MyoBlock is high units like this. It's like
MyoBlock
1,000 units.
and regular type A toxin. So do not put them and mix them. They are literally completely different medications. You can look at them as medications. They're completely different. So you're not supposed to do that. And I know there was a question about, potentially, if it doesn't last, is there going to be neutralizing antibodies? We don't actually know what's actually in the Boey right now. We still need the science behind it. Is it more of a pure core toxin of what it is, or is it
it's going to be
some
it's either
accessory
freeze dried
stuff?
or lyophilized. So it's not going to be pure. You're going to have some damage to that core molecule no matter what with the freeze drying or lyophilization.
Right.
Unlike QM or Relfydess that's in Europe,
Right.
that molecule is never freeze dried.
Right.
So I think that's why it gets in and hits so fast,
Mhm.
is because there's no damage to that core molecule.
Mm.
So that's going to be interesting too.
Yeah.
That's what they were saying in Europe. So
That'll be very interesting.
Yeah.
Okay. So onset time, as you can see, 8 hours is what
very
they say.
quick.
Compared to the duration, 14 to maybe 21 days is where you're going to see this duration, how long it's going to last. So I think that's going
2
to
to
be
3 weeks.
very interesting. 2 to 3 weeks.
Yeah.
We look at it as like, oh my God, being in the industry, oh my God, I would never pay for that. But then again, there is going to be a good subset of people, like actors, that really want to kind of freeze
Right.
it out when they have no acting. Like
Yep.
that 2 to 3 weeks is perfect timing for
Lawyers.
them. Yeah, if you need
Yeah.
to have additional motion and movement, you can at least freeze it out so those lines and wrinkles don't progress. And if you can do it for a little bit longer, I don't have I don't have a gig until 2 months later, I can do it 2 times in between and just come in.
Yeah.
And you're going to pay more, but that's the price to pay for a little bit of that naturalness and the aspect of it. So I don't think there's a complete negative aspect to that.
Yeah. And two, I think somebody asked about neutralizing antibodies. That is a concern. That's one thing I was concerned about too. But if somebody liked the effect of it, I would not keep recommending this to them. I would say, go get Bont A. Let it last longer. So you don't want to inject a toxin any more than every 3-ish months, because the neutralizing antibodies, we see it higher in people who have higher doses and more frequent uses.
Yeah, but this is a completely different medication.
But it's still botulinum toxin. So you kind of wonder about dose and frequency.
But It is, but you have to see what are the excipients out of it,
Mm-hmm.
because the thought is still neutralizing antibodies are started from the excipients,
Mm.
right? Mm?
Mm-mm.
You don't agree with that?
Mm-mm.
Oh, why?
I think it's the core molecule.
But it can't be.
Why? We've seen neutralizing antibodies do naked molecules.
Have you really?
Mm-hmm.
Okay. I
Mm-hmm.
mean, that's the argument out there.
Yeah, and it is. It still is the argument. So we might not know totally.
Nobody knows exactly
And two,
why.
maybe the MSL that mentioned that to me, who's very well aware of the naked toxin,
Mm-hmm.
maybe that patient went out and had other brands injected. I don't know,
Yeah.
right? So it's people get so many different brands and go to different clinics, whatever's Groupon is cheapest.
Of course. I mean, that's the whole thing.
Yeah.
Is like you really don't know. I mean, the hard part is now is figuring out really what is, and science will only continue to delve into this more and more and more as we do it. I mean, still the neutralizing antibodies are less. I think,
Mhm.
unfortunately, maybe with the vaccine, the COVID vaccine, it's spiked up a lot more potentials of people having neutralizing antibodies. I think that potentiated the immune system. And if you're getting a toxin injection, which is kind of like a vaccine, while you have another vaccine that's going on, your body's going, I'm catching all of you guys.
See, well, and
in that
in
aspect of it.
Bont A, I know Bont A, your body responds onto it with antibodies. So your body responds to it like it is like a vaccine when you get toxin injections. So you want those antibodies to kind of wane and put their little guns away,
Right.
before you go and assault them again. But if you keep doing it, then they're going to build the neutralizing antibodies. So you kind of want to.
It'd be interesting. I mean, somebody needs to do a research to say, let's check the neutralizing antibodies of the patients who are getting injected. Like,
Yeah.
I think Zielman should do the study, because if they're claiming with no neutralizing antibody and it really is just the core molecule, you follow that progression out on patients and see.
I have a patient I'm doing that on now.
Yeah, because
I have a patient I'm doing on that now, but
you want to see, like, I'm now injecting you with this. Does it spike your protein, or does it spike the neutralizing
Mhm.
antibody levels, and follow it out, a week out, 2 weeks out,
Yeah.
3 weeks out on the aspect of it,
Yeah.
and see where they really are.
yeah.
But let's see, clinical studies for it. They went through phase 3, 2 pivotal studies. Phase 3, open label safety study. It was, safe as always. Their data was over 2,000 patients. And as you can see, rapid onset, 8 hours after
Yeah.
injection. Durations will be between 2 to 3 weeks. And probably the adverse events are going to be similar, but at the end of the day, very short lived, because it
Mhm.
only lasts 2 to 3 weeks, which is a great thing for those that have that.
You know where this is going to be perfect, you guys? In training academies.
Oh yeah, for
This is
sure.
going to be
People are
perfect
learning.
in schools like ours. Allergan should stink and give us the stuff for free, because we can help injectors inject the models, and then we don't have to worry about a longer negative or adverse event. And they can really see by the next day the effect of what they did. They can see it by the next day. So this is perfect for training facilities. It should be in the hands of all trainers, I think, who are doing neuromodulators.
Yeah. The approval of Boey supported from data randomized multi-center double-blind placebo-controlled studies evaluating safety and efficacy. They associated with the corrugator and procerus muscle activity. They had 947 patients treated with 700 units of total dosage of Boey. So it's going to be 700 units for a glabellar component is what you're going to do. I
So
think it's
divide that by
140,
5. Was it?
140 units for each point.
And I don't know what the reconstitution is. Somebody was asking. I don't know yet.
We don't know
So
just
we'll
yet.
see.
Yeah. I would assume the reconstitutions are going to be whatever you want. I mean,
don't know.
if you have a 1,400 vial unit, right, then that means you get 2 patients out of a vial. If it is a 1,400 unit vial.
Yeah.
Because if you're treating 700 units for that, you're looking at 1,400 units.
Mhm.
So, ultimately it'll come down to packaging.
Yeah.
It'll come down to, all of that type of stuff, marketing, and how much
You
they
get
wanna
like 2
end up charging.
glabellas out of a bottle.
You get 2 glabellas out of a bottle is what it is.
So
So,
it better not be expensive.
you could literally put like a cc in there, and you get
You're right.
half a cc
Yeah.
of saline.
Yeah.
So we'll see what it really comes down to at the end of the day. Okay, these are the anatomy: glabella, right? Procerus frontalis. Procerus corrugators and orbicularis oculi.
And make sure you guys, when you do glabellar treatments, make sure you assess them with the muscle movement. And I
Yep.
always say, read the muscle like a book. Just learn the language. So look at where the skin moves, and wherever the skin is moving, you can tell what muscle is under there and what's making it move. Don't hit the line, hit whatever's making the line.
Mm-hmm.
Look at the cause, don't look at the symptom. So
Yep.
treat the cause. A lot of people will treat do a 3 or 5 point injection here, and you've got this whole orbicularis oculi
Yep.
recruiting and pushing in,
Oh yeah.
and they miss the entire outer component
Yeah.
of the indraw
Yeah.
of that.
That's this
that frown.
patient.
That's her. I would treat
That's
her
her.
out
Totally.
further.
7 points, not
Mhm.
5 points.
I
would
do 7-point injections
Yeah.
probably 99% of my
I do
days.
too now.
Yeah.
I'm back up to a
On
7
everybody.
point injection.
Yeah.
So that's kind of where we have to
We need
look
to write that back up.
the anatomy.
Let's
Yeah,
write that
up. I know. So patients seeking treatments for frown lines, glabellar lines, of course. The good candidates are first-time neuromodulator users who don't know what it's about and just want to dip their toe in and then don't want that frozen look. I think
Yeah.
that's great. People who don't want to commit to it. I think people who are actors, actresses who literally have that short amount of time to try to look beautiful and so that they don't keep aging, because they do need their facial expressions
Mhm.
for
Mhm.
their acting on that aspect of it. So people who want to just do it one time for a wedding or photo shoot or something that they need, I think this is a great tool. And then, like Lori says, for those beginner injectors that are just like, I'm scared, I don't want this to last for 3 months. Well, you can start off using the type E's, and
Yeah.
then as you get comfortable with it and seeing, okay, this is working, then you can move into the type A's.
Yeah, and
It's
I don't-
like
I
a little
don't-
training wheels.
I don't know if they're going for a therapeutic indication on this. They might not be, but when you're doing therapeutic dosages, you're doing really high dosages.
Mm-hmm.
And you want to make sure you hit the right muscle, like an overactive bladder. You want to make sure you hit the right muscle. So this would be a great test spot.
Yeah.
It'd be a great testing product to use to make sure you've got the exact location. It could be for strabismus. It could be where you have the exact location of where you want to weaken that specific muscle.
Yep.
And once you hit it, you know where to go. So with a longer acting neuromodulator. So there's a few really good ways this could be used
For sure.
therapeutically, I think.
Yeah. Transitioning patients into long-term patients. I think, and it's smart of Allergan to look into it as a gateway, as like a transitional, thing. And lose the gateway drug.
It's your marijuana
Try
to your
li-
heroin. It's your gateway drug.
People who are just starting it, not too sure, let's try it, and then moving into full strength Botox. I think it is very strategic on their aspect of it, because you're gaining the data behind the patients who are utilizing it,
Yeah.
and that's key and important on that aspect of it. So
It's definitely got
Um,
its purpose. It's
yeah.
definitely it's got a place. I mean, I don't think we need to poo-poo this. Maybe we're not going to use this all the time in our clinics, but
Right.
there's a certain patient demographic that just want to try something really quickly, and they'll pay to just
Yeah.
try it a little bit, and they don't want a big long
Yeah, for
result.
sure.
So there will be a few of those patients, and the ones that we've mentioned, the weddings, the actors, the psychologists, the whatever. So there'll be a few of those. But I do think the training centers are the meat. I think it's going to be the meat.
I think it's great for
I do.
Yeah, the training centers for anybody jumping in the industry that wants to learn how to do toxins. I think when we first got started with toxins, that was the biggest fear, right? Oh my God, this is gonna last 3 months. It's
Should
gonna
we
last 3
talk?
months.
Should we talk about some of my adverse events with neuromodulators?
And this may be a good one for those areas that you're just trying out. Like, I don't know, let me play in the area. At least to know it's not gonna last very long,
Yep.
and then you can say, okay, I'm getting more comfortable in the area. Let me shoot them. DAOs, not hitting the DLIs. If you mess it up and you hit DLIs, at least that only lasts for 2-3 weeks,
Right.
and then it's gone. And so
Yeah.
okay, I need to adjust myself, learn how to do that
The
better.
Razorius. Has everybody seen the girl with double Razorius hit on their masseters on
Oh,
Instagram? She's some influencer or something, and she's like, "See, this is what happened to you. I'm trying to smile right now." And it's hilarious. And everybody's trying to explain, yeah, you hit the Razorius. That's what
Yeah.
happens. But that can happen even with a good injector.
Yeah.
It happens more with an inexperienced injector, but that can, you don't know where someone's Razorius interdigitates. But yeah, we see a lot of adverse events. And now she's going to have to live with that for a few months. Whereas if this was Bont E, couple weeks, it'll probably be done,
Yep.
you know?
Yep.
Yeah.
So I said it's about the conversion funnel for those that
Yeah.
new prospects into let's try it out, and then if they love it, then they move into Botox, and then they become a repeating brand user. So there's a little psychology behind it. Allergan is very smart
hmm
about this. Allergan is very, very smart about how they are placing this product. So you can do the patient journey. Boey's introductory, Botox becomes a sustained results. Yeah, as you said, brilliant kind of portfolio management in that piece of it.
Yeah, it's very low risk. And
Yeah.
if some people do come in and the toxin is like their first step into anything aesthetic, and it's very, very low risk, and they might feel more comfortable with something like this
I
initially
mean,
before they.
definitely. I think there's a lot of people out there that's
hmm
peer over the fence, like, oh, I kind of want to try it, but I don't want to commit to it. I want to try it. Your guys who want to do it, you can say, hey, do it 2 to 3 weeks. Nobody calls you out, then we can do something that's longer lasting to really take care of those lines and wrinkles. I think there is a huge market. This may bring in more of a marketplace to us in that sense.
I'll be right back.
Oh,
Somebody asked a question. I was
oh,
going to try to find a
oh, okay.
syringe.
Treatment and patient overall experience, perform this can be exactly what you would typically do for your typical toxin. I don't think this is going to be anything different. I think you're just going to have to get used to the reconstitution, and we'll figure that out once it comes in there. Reconstitution just depends on what you want. Even with the current neurotoxins, I know everyone goes, oh, what dilution do you do? What do you do? Really, the more dilute you get, the more potential spread it is. The more concentrated a neurotoxin is, the more it stays kind of in an area. That is the key to dilution. So, if you ask me what dilution do you use, I have a dilution because I have lots of practitioners. I want it replicatable. I don't want the mistakes. Lori has it where because she's more of a single practitioner, she has 2 different dilutions in her practice where it's more concentrated because she wants more concentrated in one area, and she wants a little less concentrated in the frontalis, maybe the crow's feet. So it has a little bit more spread. So realize you guys need to understand why you guys are asking these questions of dilution. I get that asked all the time. And I'm like, I could care less how much you dilute it as long as you have a reason why you're diluting. When I do hyperhidrosis, I'm 4 cc's because I want it to really spread a little bit more. I do traps, body parts, I do 4 cc's into whatever toxin is. So I have more liquid, so I have more spread of the toxin into the area. The more concentrated, the more it sticks into an area. Labellar, it's a great little area, a very small area. You want it to stick into that muscle. So,
and as far as like if you're already doing toxins now, it's like it's the same medical history. You don't want any neuromuscular disorders. It's the same medical history. Nothing's different. Just think of this as a shorter acting Botox or whatever.
Yeah.
So don't think. Somebody asked us about where our 7-point injections are.
Yay!
Here we
Great.
go, kids.
Sacrifice.
I know you're probably frozen. You're frozen. Anyway, if somebody has a line here, which I'm not going to be able to wipe you off. So the base of the procerus is here. So this is where your initial base of the procerus, if they get a wrinkle here, that's where the origin is. You want to hit the origin. You're going to hit the corrugator inside of their brow, which is usually where the muscle originates. Usually you're going to have a tail. You're going to have like a little V right up in here somewhere, which is where the corrugator pulls in. And then out here, try to look bad. Out here, you're going to see wrinkling here. You can go right along that brow, which I'm actually doing a 9-point injection. You can go all along that little brow, really. And that's kind of where you can go where someone pulls in. So this is a 9-point injection. I do a lot of those too. If you don't need to hit this one, then don't do that one. That's a 7-point.
Yeah.
So it's just adding these extra ones. If you see their orbicularis oculi, pull in. That's all we're doing.
And remember, you want to hit it in the brow or at the top portion of the brow is really where you kind of hit it. You want to actually put your finger and feel where the orbicularis contracts. Remember, it's a circular muscle. So you're going to want to definitely hit those people that have these eyebrows that when they contract, it flattens out. If you see this pull in and flatten out, they have really, really strong orbicularis muscles. You should definitely be hitting that. So I think a lot of people don't evaluate and don't take caution to the fact that the whole glabellar component is going to be procerus, depressor supercilii, corrugator, as well as orbicularis. And understanding all those muscles is important, and that's why you guys want to do an anatomy class. So you can actually dissect it out and see where all these muscles really lay.
You're welcome.
It was very eye-opening because that I think sitting with Codafon and really watching him dissect out those corrugator muscles, that was like,
Wow.
oh crap, we're hitting it way too high. All of
Wow.
those pictures where we're hitting it above the brow, wow. That's the reason why I
Wh-
got every so often I got a medial brow ptosis, and you get these duncy looking patients. It's just like, why does it look
Because we were
like
hitting
that?
frontalis.
Yeah.
We weren't hitting. We were hitting way too high. We were hitting
Mm-hmm.
frontalis and not the depressing component
Yep.
of the corrugator superciliaris,
Yep.
because it goes all the way around here. So if you hit only up here, you're not going to hit this part here that's pulling down.
Yep.
So that's really important to look at. And some people get lots of straight lines right here. They get lots of
Mhm.
little lines right there. I will inject them. I will
Superficially.
inject them in here. I won't mark you, but I would inject them right here, very superficially,
Mm-hmm.
because it stops that gathering that happens right there. So
For sure.
yeah.
For sure. All right, back to our PowerPoint. Any more things? So recommended dosing, as you can see, 700 units divided into, they say 5 equal units. That's how they have to do it. So 140 units per site. Half a cc is what you're doing. It's exactly what I saw,
Mhm.
what I told you. It's 1,400 unit vial, reconstitute with 1 cc. So your final concentration is 140 units per 1 ml. So every injection point, 0.1 ml.
A tenth everywhere.
A tenth everywhere. Okay.
Yeah.
I think everything else is pretty much going to be the same.
So what's nice is if you guys already do Xeomin, Jeuveau, and Botox and Latibo,
Mm-hmm.
and you put 2.5 cc's in your vial, you will be injecting the same volume with this as you do with those. So 1/10 is the volume you will be injecting.
So
If
essentially,
you
you
already
could say
do 2.5
140
cc
units
dilution.
is equal to 4 units.
Yeah.
If you really had to do
If
it.
you have it, yeah. If you already have 4 units per tenth.
Yeah.
Mm-hmm. Perfect. We showed the injection points. We always do a little extra. We always do 7s. I do.
And then we talked about this recovery onset 8 hours after injection, short duration 2 to 3 weeks. Typically, your Botoxes, your Dysports take 3 to 5. For me, like Botox takes 7 days for it to completely kick in or to start kicking in. And
Me
then
too.
It took
Took a
14
week,
It
if
took
not
a
more.
while. Yeah.
Whereas
So-
like Latibo took 2 days with me. Dysport took 2 or 3 days.
Yeah.
So we'll see. Yeah.
And everyone is going to have its little nuances, with regards to all your toxins.
February,
Yeah.
March, April, May, June, July. Okay. I'm at 4.5 months, almost 5 months. This is Jeuveau. Remember when you did me?
Oh, yeah.
This is Jeuveau. This is Latibo.
Okay.
So I don't know.
They're
This is
both,
Jeuveau. This is Latibo.
They're both about similar. The Latibo is maybe moving a tiny little bit more.
I can't even.
Raise up. Relax. Raise up. Yeah, maybe the Latibo, but this may
Little
be
bit.
I think, but this is your eye you talk more with naturally.
No, this is my higher one.
That's your high one?
This is my stink eye.
Oh,
yeah.
okay. This one moves a tiny
bit
little
more.
bit more right
and
there.
then, but this
Tiny
is
little bit
almost
more.
5 months, you guys.
Yeah.
With
So you can
both of
see
them.
Both of them are actually,
So we did it for
Yeah.
fun.
we did it for fun to try it out, see if there really is a difference. Jeuveau versus Latibo, and so
Yeah.
works just as well.
Just for fun.
Aftercare going to be the same as what you typically do. Don't rub it or massage it for the next 2 to 3 hours. I was wondering how quick the uptake would be if they could do studies with regards to that.
Wait. Did we miss this? Remain upright for several hours after treatment. How
yeah.
did we not take that out?
Oh, I don't
Okay,
know.
forget that. That is a lie. I missed it. Sorry, you guys. No, that is a wives' tale. You can go take a nap immediately after your toxins. That's a wives' tale.
Yes.
So
The only thing I tell patients is don't rub or massage the area for the next
I
2 to
missed
3
that.
hours.
I
The
missed that.
rest of it, I kind of don't worry about.
Yeah. So don't worry about laying down. Don't worry. It will be absorbed into the motor end plate. It stays there permanently within about 2 hours.
Yes.
So you just don't have to do anything crazy for a couple hours, and that's fine.
Safety complications, I think the temporary injection site,
Bruising,
this is going to be the
yeah.
same. I
No
mean,
different.
honestly, it's going to be the same as everything else out there as far as neurotoxin is concerned.
Yep.
We're not sure about the pricing as far as that's concerned, so we'll figure it out. I mean, I'll figure out in Canada what they're pricing it out.
Well, they're cheap too, but
They're probably
but just know that when we get this vial, it's going to be it will give you 2 glabellas out of it.
Yes. So 2 areas.
So it's not even a 50 unit vial it's a little bit less than a 50 unit vial.
Yeah.
No, actually a 50 unit vial, 20, 40,
It's a
60.
little bit.
Yeah, you'll get like 2.5 glabellas out of a 50 unit vial of Botox. This will give you 2 glabellas. So it'll give you a little bit less than a 50 unit vial of Botox. So I'll give you an idea of where the price matches kind of up. Yeah.
So we'll have to figure it out. If it's priced too low, people probably won't bring it in. If it's priced at a good price point, I think people will bring it in for those that are like, I'm not too sure. I don't think it's something that you're going to buy a ton of, but it may be something to keep in your practice on the aspect of it.
Excellent.
Future use summary. We talked about this. I think it's a very unique emerging neuromodulator. It's rapid onset, short duration. It's going to be really cool. And it is going to be a fun little product to use. Okay.
Nurse Martha is saying she loves the marker. Where can you buy it from? I'm obsessed with these markers. These are called Scribe, Skrybe. Can you guys see them? There's a name on here. Anyway, they're Skrybe. They are little felt tip pens. They last me probably a month or more. I have the face cleaned before I mark them, and they wipe off really easy. If you go onto my Instagram, Injection Expert, and you go on the link in the bio, you can scroll down and there's a discount code for this. It's an Aesthetic Immersion, 10% off or something for these. So it's a really nice doc we met in London years ago who developed these.
Yeah.
So Scribe, Skrybe. We love them.
S-K-R-Y-B-E.
They're my favorite. That's all I use.
What does nothing creasing after toxin mean? Exercise, sauna?
Standing on your head, doing what do you call that? That heavy exercising.
HIIT.
Like the heavy, like you're jumping on stuff and throwing balls. And,
I forgot what that
anyway,
is.
that really heavy, like really strenuous exercise. Don't go run a marathon just for a couple hours. That's
just
it.
for 2-3 hours.
Yeah, do normal.
This point in time, we know that the neurotoxins typically absorb in within about 90 minutes.
Yeah.
It locks into place. And so
hit CrossFit. Yes. Thank you, CrossFit.
Yes.
Thank you. Thank you. I do it every day. Can you tell? Oh my gosh, that's hilarious.
All right. So we're at the end of this.
We're good.
We're good.
Wow. I know we went over a little bit, you guys, but we had fun with you. Thank you so much for asking us questions.
Thank you guys.
And hopefully you kind of got a little idea of what Boey is going to be like. Not that different, but maybe have some uses for it that we really hadn't thought about before. So we'll see.
We'll definitely see.
It lets me see. So we'll see how it goes.
All right. So our next AI Live is going to be August 11th. So it's going to be the second Tuesday of the month, not the first Monday or first Tuesday of the month.
Mm-hmm.
So August 11th at 5 p.m. We're actually going to be talking about Obagi Magic. Okay, which is one of the new fillers that's on the marketplace. It's actually really good.
Yeah.
We actually
really nice.
like playing with it.
Yeah.
So, we'll definitely have Kevin Harrington here. He'll be talking about magic, and we'll see where you guys take it, because with the more and more of these newer fillers coming in the marketplace, it's gonna make the marketplace very saturated. And so you guys gonna have to figure out, what do I want to use? Why do I want to use it, and stuff like that. So we'll probably talk with Kevin Harrington and kind of pick his brain on where magic is. It's not a new filler, guys. It's actually been in Europe for over 9-10 years.
About 12 years.
And so it is it actually, in my hands, I've actually played with it. It's actually pretty darn
It's beautiful.
cool. So join us August 11th at 5 p.m. for that. Other than that, this will go up on our YouTube channel for the Aesthetic Immersion if you want to rewatch it. Other than that, thanks for watching.
Thanks for watching, you guys.
We'll see you at the next AI Live.
See you next month.
Thank you for watching.
Don't forget to like this video and subscribe to the Aesthetic Immersion channel.
And check out all of our other videos we have to offer on YouTube.
And if you're on the road, we have a podcast version of AI Live and even our mentorship call. See you next time.